Today we are going to discuss a chapter in pharmacology which is anti-asthmatic drugs. So to start with, we'll understand the definition of asthma. It is basically characterized by something known as airway inflammation and episodic reversible. Okay, just know the term reversible because in COPD it is irreversible. Okay, it's irreversible. Now, so it's characterized by reversible bronchospasm. So two terms which you should know here is airway inflammation and bronchospasm with severe shortness of breath. Definitely understandable. There is severe inflammation and severe bronchospasm. There is going to be severe shortness of breath. Now, let's come on to the therapeutics part. Now, first we said there is inflammation, and then there is bronchospasm. So the drug which we use for bronchospasm is bronchodilators. Understandable, isn't it? Then, if there is inflammation, what we are going to use? We are going to use an anti-inflammatory agent. When it comes to bronchodilators, it's called reliever drugs because if there is a severe kind of bronchoconstriction, there is immediate relief. That's why it's called reliever drugs. Okay, reliever drugs. Then we have the ones which are anti-inflammatory. These are called controller drugs. It just controls. Okay, it controls inflammation. Now, to understand the drugs better, you have to understand the pathophysiology of how asthma occurs, or how the bronchoconstriction and inflammation occurs. Okay, so first, as you could see here, this one, which is the antigen, you have got the antigen out here. It comes and binds with the IgE, which is on the surface of mast cells. Okay, we have studied this in hypersensitivity. Okay, which is immediate type of hypersensitivity reaction. So once this binding occurs, what's going to happen next is this mast cells are going to get bursted up and it is going to release its contents, which is leukotrienes. You're going to see this leukotrienes are potent bronchoconstrictors. Okay, these leukotrienes are very potent bronchoconstrictors. So this is what is the major part of inflammation which you're going to see. Okay, which causes the bronchoconstriction. Now what? This leukotrienes, now what happens is, how is this bronchoconstriction brought about? It binds with the receptor which is there on the surface of the cells, any cell. This is any cell. Okay, on the surface of any cell. What is the name of this receptor? The name of this receptor is cystinyl leukotriene receptor, or you can call it a cis-LT receptor. This binding of leukotrienes, on its receptor brings about the bronchoconstriction. Okay, now let us see what are going to be the drugs. The first one, which is going to be the drugs which inhibits IgE. This IgE has to be inhibited so that mast cells are not activated and you're not going to get the inflammation as well as bronchoconstriction. So that's drugs inhibiting IgE. Okay, we'll discuss them in detail as we go on. Then you have got the next group of drugs, which is mast cell stabilizer. Stabilizer means what? It doesn't allow this release of leukotriene.